If you're over 60 and someone asked you right now if you could catch yourself if you started to fall, what would you say? Most folks answer yes without thinking twice. They feel pretty steady. They walk every day. They're careful on stairs. They've never had a bad fall. But here's what I've seen after 20 years of working with older adults. The folks who feel the most sure about their balance are often the ones who have the hardest time when their body is actually put to the test. Not because they're weak, not because they're careless, but because feeling confident and actually being able to do something aren't always the same thing. And the space between those two things, that's where falls happen. And here's the kicker. That space doesn't just show up out of nowhere. It grows slowly over months and years. You don't wake up one morning and suddenly realize your balance is shot. It happens so gradually that you adapt without even knowing. You make little changes. You stay away from certain places. And because you're managing okay, you still feel good about yourself. Until one day something catches you off guard. And right then, you discover that the gap between how capable you feel and how capable your body really is has gotten way bigger than you thought. I want to talk with you today about something most doctors don't have time to explain. But it matters more than just about anything when it comes to staying independent as you get older. If you're walking every day, watching where you step, holding onto railings, and doing all the stuff you've been told to do to stay safe, you're already doing better than most people. That's worth something. But here's the part nobody really talks about. All that being careful helps you stay away from places where you might fall. And that's good. But it doesn't actually get your body ready to catch yourself if something unexpected happens. Walking on flat ground doesn't teach your body how to stay steady when the ground isn't flat. Being careful on stairs doesn't train the quick reactions you need when you miss a step. And holding a railing helps you out. But it doesn't make the inside systems stronger, the ones that keep you upright when there's nothing to grab. Think about it like this. If you only ever drove on perfectly straight roads with nobody else around, you might feel like a great driver. But the first time you had to merge onto the freeway, you'd find out real quick that you hadn't really been tested. You'd been safe, but you hadn't been ready. That's what's going on with balance for most people over 60. They're being safe, they're being careful, but they're not actually getting their bodies ready for the moments that matter most. I'm a doctor. I'm 45, and I've spent the last 20 years working with older adults, helping them stay steady, confident, and independent. I'm not here to sell you anything or freak you out. I just want to have a real talk about something that hits almost everyone over 60, but nobody really brings it up until it's too late. And I want to have this talk now, while you can still do something about it. Because the time to work on balance isn't after you've already fallen. It's not after you've already lost your nerve. The time is now. While you're still getting around. While your body can still learn and get better. Here's what happens to your body after about age 55, and this is totally normal. This isn't some disease, this is just how bodies age. Your reaction time gets slower. Not by a lot, but enough that the time between when your brain realizes you're wobbling and when your muscles kick in gets just a bit longer. We're talking milliseconds, but those milliseconds really matter when you're trying to catch yourself. Your proprioception, that's your body's GPS, gets less sharp. Your body isn't quite as tuned in to small weight shifts or changes in the ground as it used to be. Your inner ear system that helps you balance starts to fade. Not hugely, but enough that your body doesn't fix itself quite as automatically as before. And those small muscles that steady you, the ones that make hundreds of tiny fixes every time you stand or walk or turn, they get weaker if they're not being pushed to work. These muscles don't get stronger from regular walking. They don't get stronger from hitting the gym. They only get stronger when they're actually challenged to do the work of keeping you steady. None of this means you're falling apart. It just means your body is aging like every human body does. But it does mean that your room for mistakes gets smaller. And here's what most folks don't get. That smaller room for error doesn't just affect what your body can do. It messes with your head. It affects your confidence. It changes what you decide to do with your life. When we talk about falling, Most people think the danger is about being weak or fragile. And yeah, strength matters. Being strong is important. But the real danger isn't being weak, it's losing control. It's what happens in that split second when your foot hits uneven ground, or you turn too fast, or you stand up and feel dizzy for just a moment. Right then, your body has to make a super quick call. Can it fix itself? Can it steady you? Can it catch you? And if the answer is no, that's when you fall. Not because you weren't careful, not because you weren't watching, but because your body didn't have what it needed in that moment. Think about where falls really happen. It's almost never on a totally flat sidewalk in broad daylight when you're paying full attention. It's stepping off a curb that's higher than you thought. It's turning around in your kitchen and feeling your weight shift weird. It's reaching for something up high and losing your center. It's getting up from a chair and having that quick moment where the room feels tilted. It's walking outside and stepping on bumpy ground you didn't see. These are everyday things, normal stuff, things you've done thousands of times before with no problem. But they need your body to do something that doesn't happen by itself anymore. They need active steadying, and here's what makes this so tough. These moments come when you're not ready for them. They happen when you're thinking about other stuff, when you're distracted or tired or rushing. That's why just being careful isn't enough. You can't be on high alert every single second. Life doesn't work like that. You zone out, you get tired, you hurry sometimes. And in those moments, your body needs to be able to react on its own, without you thinking about it. But that automatic reaction only works if you've trained it. Doctors and physical therapists use simple tests to check how well someone's body can handle these kinds of moments. These aren't medical tests like blood work, but they do show us how your body acts when it needs balance, control, and quick moves. And that matters because it tells us if there are gaps that need fixing before they turn into real problems. There's one test I think really shows a lot because it's so simple, and yet it tells us so much. This is the moment I want you to be honest with yourself, not scared, just honest. One of the easiest and most eye-opening tests we use is this. Stand next to something solid, like a counter or a chair, something you could grab if you had to, but don't hold it. Pick one foot up off the ground and hold it there. Just stand on one leg. See how long you can stay like that without wobbling all over, without putting your foot down, without reaching out to catch yourself. That's it, just standing on one leg. Now, this might sound too easy to mean anything, but here's why this test is a big deal. Standing on one leg makes your body do everything it needs to do when you're walking, turning, reaching, or dealing with bumpy ground. It makes your steadying muscles work. It makes your body's GPS give you good info. It makes your inner ear help you stay level. And it makes all these systems work together, smooth and quick. When you're walking, every single step has a moment where all your weight is on one leg. When you're turning, there's a moment where you're balanced on one leg. When you're stepping over something, you're balancing on one leg. So this simple test is actually testing the main skill behind almost every move you make all day long. If you can hold that spot easily for 20 to 30 seconds without much struggle, that tells us your body's got good basic steadiness. Your muscles are doing their job. Your body's sensors are working right. If you start wobbling in 5 or 10 seconds, or if you gotta put your foot down right away, that tells us your steadying systems aren't as quick as they should be. It doesn't mean you're in danger right this second, but it does mean there's a gap between what you can do now and what your body needs to stay safe when real life happens. And if you feel nervous even trying it, if just the idea of standing on one leg makes you worried, that's info too. That tells us that somewhere along the way, you've lost trust in your body's ability to keep you steady. This isn't a pass or fail thing. It's not about being good enough or not good enough. It's about knowing where you are so you can figure out what to do next. And lots of people get better at this with the right help and practice. I've seen folks in their 70s and 80s make huge improvements when they stick with the right kind of training. Your body doesn't lose the ability to learn just because you're older. It just needs the right kind of challenge. But here's what I see all the time. Someone tries this test and figures out they can't do it. Maybe they wobble right away. Maybe they have to put their foot down after just a couple seconds. Maybe they feel so unsteady they're scared to even try. And instead of thinking, okay, this is good info, they feel bad about themselves. So they don't tell anyone. They don't mention it to their doctor. And they for sure don't do anything to fix it. They just get more careful, more cautious. And that being extra careful, even though it seems like it's protecting them, actually makes things worse over time. Because being more careful means staying away from the exact situations that would challenge and strengthen their balance. Why do so many people have trouble with something as easy as standing on one leg? It's not because they're lazy, it's not because they're out of shape. Lots of the people I work with are pretty active. They walk. Some hit the gym. Some do yoga or Tai Chi. It's because modern life doesn't make you balance like that anymore. Think about your normal day. How much time do you spend on really uneven ground? How often do you have to balance on one leg? How often do you have to make quick moves to keep your balance? We walk on flat, smooth surfaces. We've got handrails everywhere. We've got solid furniture to lean on. We sit more than we stand. And our bodies adapt to what we ask of them. If we never challenge our balance systems get dull. If we never practice steadying ourselves on one leg, our body forgets how to do it well. If we never put ourselves in spots where we might feel a little wobbly, our steadying muscles don't get the push they need to stay strong. Your body is super smart about saving energy. It doesn't keep up skills, it doesn't use. And if you set up your life so you never need single leg balance, never need quick reactions, never need to steady yourself on bumpy ground, your body will adjust to that. And then one day, when life throws something at you that your body hasn't practiced in years, you find out the skill isn't there anymore. When the early signs of balance going downhill get ignored, here's what usually happens. It's sneaky at first. You start staying away from certain things without really deciding to. You stop wearing slippery-soled shoes. You take the elevator instead of the stairs. You pause before stepping off a curb. You hold on to furniture when you walk through a room. You say no to invites to go places where the walking might be tough. These changes feel smart. They feel like taking care of yourself. You're keeping yourself away from spots where you might be at risk. But what they really do is make your world smaller. And as your world gets smaller, your confidence gets smaller too. And as your confidence drops, your body gets even less practice with the exact skills that would keep you safe. And as your skills drop more, your world shrinks even more. It turns into a loop, a downward slide. And the longer it goes, the harder it is to turn around. I've watched people go from being active and independent to being scared and limited in just a few years. Not because they had some major health crisis, not because they had a terrible fall, but because they slowly, bit by bit, without even knowing, it stopped challenging their bodies in the ways that mattered. And here's what really gets me. It doesn't have to be this way. Aging is real. Bodies change, but how fast you decline, how much you get limited, losing your independence. So much of that depends on the choices you make and what you do about it. There's a smarter way to think about aging well, and it's not about working harder or doing more stuff. It's about training smarter. Walking is awesome for your heart. It's great for keeping your legs strong. It's good for your mood and your brain. Keep walking. I tell everyone to walk. But walking on flat ground doesn't train balance. It doesn't push your steadying muscles. It doesn't make your reactions faster. Stretching is great for staying flexible. Keep stretching if it feels good. But stretching doesn't teach your body how to stay steady under pressure or how to catch yourself when you're off balance. Hitting the gym and using weight machines can build strength. And strength matters. But most gym stuff is done sitting or lying down with support. Your body doesn't have to work to keep balance while you're lifting. These are specific skills, and they need specific kinds of practice. The kinds of moves that really help balance usually have a few things in common. They make your body stay in control while your weight is shifting. They make you steady yourself on one leg or on something wobbly. They train your body to react fast when something unexpected happens. They build confidence by showing you your body can do more than you thought, and they get harder bit by bit as you get better. I'm not going to walk you through exact exercises here because training should fit each person, and you should have someone watching, especially if you're just starting. But if you're working with a physical therapist or a good trainer who gets aging bodies, these are the kinds of moves you want to focus on. Not generic stuff, not routines made for younger folks, but focused, step-by-step training that starts where you are and builds the exact skills your body needs. And here's something key. This kind of training doesn't take forever. You don't have to totally change your whole life. 15 or 20 minutes, 3 or 4 times a week, of real balance and steadying work can make a huge difference. I've seen it happen again and again over 20 years. But it's gotta be the right kind of training, and you gotta stick with it, and it's gotta get a bit harder as you improve. Picture yourself 5 years from now. Imagine walking easy on bumpy ground. Imagine stepping off a curb without thinking twice. Imagine turning quick without worry. Imagine reaching for stuff without thinking about losing your balance. Imagine going places you want to go without checking if it's safe enough. Imagine having that quiet knowing that if something catches you off guard, your body can handle it. That's not a pipe dream. That's what happens when you give your body the right kind of work and attention. And I'm talking to you about this now because it's way easier to build these skills before you need them than to try to get them back after you've already fallen. After a fall, everything changes. Even if you're not hurt bad, it messes with your head big time. Fear creeps in, second-guessing creeps in, and that fear and doubt makes everything harder. But right now, you've got a shot. You've got the chance to take action from a strong place instead of a scared place. You've still got time. You can still influence how this part of your life goes, and that's worth paying attention to. Before I go on, I gotta be clear. Everything I'm telling you today is just info to help you learn. It's not medical advice. It's not meant to replace talking to your doctor or a licensed physical therapist. If you've had falls, feel unsteady, or have medical conditions or medications that affect balance, talk with your doctor or physical therapist first. They can help. You choose what's safe for your body. That's not fear. That's smart. This talk is meant to teach you and help you understand what matters, but it's not meant to replace one-on-one help from a pro. I'd like to hear from you. If you're cool with it, drop a comment with your first name, roughly how old you are, and where you're watching from. Not because I need it, but because it helps build a group of people who are serious about aging well. When you see other folks your age talking about this, it makes it normal. It makes it easier to bring up stuff that usually feels too personal or too uncomfortable. Maybe you've noticed your balance changing and you haven't told anyone. Maybe you've been worried about falling but didn't know what to do. Maybe you've been doing balance stuff and want to share what's worked. Whatever your story is, I'd appreciate hearing it. Because every person willing to talk openly about this makes it easier for the next person. Here's what I want you to remember. Your body can still adapt and get better, even now. The changes that come with getting older are real, but they're not set in stone. You've got more control over how you age than you probably think. And the small stuff you do now to understand and train your body will pay off big time in staying independent, feeling confident, and having a good life for years ahead. You don't have to just accept getting worse as something that has to happen. You don't have to make your world tiny to stay safe. You don't have to become someone who's scared to go places or do things because you're worried about falling. You just gotta be willing to pay attention. Be honest about where you are. Take smart action based on that, and commit to giving your body the kind of challenge and training it needs. That's not asking too much. And it's not too late to start. The best time to start is while this is fresh in your mind. When you're still doing well and you can build these skills before you truly need them. Take what you know and turn it into action. Talk to your doctor, find a physical therapist who works with older adults. Start noticing how your body handles balance challenges. Make this a priority because staying independent matters. Feeling confident matters. Your quality of life matters. And all that stuff is directly tied to your body's ability to keep balance and control. Thanks for hanging with me. I hope this helped. I hope it gave you something worth thinking about. And I hope it reminded you that you're worth the work it takes to age well. This isn't about trying to look young forever. It's about keeping the physical skills that let you live the life you want to live, to go where you want to go, to do what you want to do, to stay independent and confident and connected with the world around you. That's what this is really about. Not just preventing falls, though that matters, but keeping the life you want. Because balance isn't luck, it's a skill. Take care of yourself. Pay attention to your body, give it what it needs, and trust that the work you put in now will help you out big time down the road.